I have this framework where we have two axes. And again, you probably can't read that. It says educated consumer on the left side. So that's the being informed, being educated about understanding substance use disorder, how treatment works, and what recovery looks like. And so the two ends of the axis here, down on the bottom it says uninformed, and up at the top it says informed. Then our second axis is going to be boundaries. It's going to range from low to high as far as in our ability to set effective boundaries. Okay? So by using these two axes, we're going to look at how this framework works. Somebody, let's say, who scores high on the boundaries scale, but low on the educated consumer scale, is possibly going to come across as being controlling. Let that one sink in for a second. Good at setting boundaries left and right, uninformed about why the boundaries are really being set, not having a good understanding about what would be the appropriate boundary. They're going to come across as, I have words that I shouldn't say in public, as they're going to be a such and such. And controlling is a polite word to put that. Some of you can, put ones in the chat box or something if you relate, or comments if you see yourself in this thing here. But so you're setting boundaries, but the thing is, you don't have a good informed base. And the people on the receiving end of the boundary, on some level, know that you don't have it. You're just being, mean by controlling by setting that boundary. On the other hand, let's say someone scores very high on the educated consumer scale. You're reading all the books and you're going to all the meetings and you're learning as much as you possibly can and listening to podcasts about recovery, but you have trouble setting boundaries. That person may possibly come across as feeling defeated. You know how things should be. You know how you want things to be, but man, we just never get there. And we can end up feeling defeated. And then if you have someone who scores low on boundaries and low on the educated consumer scale, that's where you might see the chaos of, for sure, the unaddressed problem, like how a family system probably is prior to intervention in getting someone to that place. And so again, if you got any comments to put in yourself, I always stop here when I'm working with families and say, where do you see yourself in here? And this can give a really valuable roadmap, a picture. They'll say, well, I see myself a little bit, I'm in the middle on the boundaries thing. I'm really low on the educated consumer stuff, or vice versa. And if you plot yourself on there, you can see what you need to work on. And again, there's information out there. If you have access to the information through your treatment program, treatment providers, my one message to you guys here is hopefully this gives you some insights, maybe some different thoughts that you can take back to your program, evaluate the effectiveness of the content that you are delivering, and helping families make progress towards this. Because ultimately, if you score high on both of these scales, that's where you're going to reach that peace of mind. And the beauty of this is you see how these reinforce each other. Being informed, understanding why, no, it's not a good idea for you to continue hanging out with your using friends. Or no, it's, not doing anything to support your recovery after getting out of treatment is not following staff recommendations. You're going to figure out a boundary. You being informed, is going to help you inform your boundaries, and it takes some work on figuring out what the right boundaries is. I can't give specific answers to what you do in this case or this case. Those are kind of things that it's often helpful for you to get your own counseling to help you, hash through some of these things, the factors that go into what would be the appropriate boundary. But when you do land on being able to set a healthy, informed boundary, that gives you the confidence of knowing that you don't have to apologize for the boundary you're setting. You don't have to defend it. And then best of all, how they respond to that doesn't have to affect your peace of mind. Because you have done all this work in getting to the point of setting an informed boundary. And that ultimately, that is what recovery is. One of the things you'll hear, treatment programs talking about going to al-anon. Al-anon is the format for they're teaching you how to identify that yellow line we looked at in that slide earlier and step out of reactive and being engaged in that dysfunctional dynamic.